Welcome to Cups and Courage, the podcast. Our next guest is Tashmia. Tashmia was diagnosed in 2019. She had chemotherapy, immunotherapy, radiotherapy, and a single mastectomy with immediate reconstruction. Cups and Courage, the podcast. Welcome, Tashmia.
Thank you.
Thank you for being here. I'm really looking forward to this conversation. I'm also looking forward to seeing what's inside the biscuit barrel. So, as a tradition, we ask our guests to bring in their favourite biscuit, and I never know. Never know. Dark chocolate?
Yes.
Dark chocolate digestives?
Yes.
Good.
Thank you.
Thank
Do
you.
you like them?
I do love dark chocolate biscuits. But people don't always go for them, you know?
Yeah. No, most of my friends like the milk chocolate ones.
Yeah.
So I don't mind because then I don't have to share.
Full stop. Full stop.
Yeah.
So we're going to go straight into the deep end with a
Yeah.
big question.
Mm.
And so I'm going to pose this to you. What's your definition of courage?
I've been thinking about this quite a lot for years, actually. And I don't think I have sort of one set thing to say or how to answer it in, a specific way, apart from probably just putting one foot in front of the other. And it's only when you get so far and you look back, you realize how courageous you may have been. But at the time, it's just putting one foot in front of the other.
That's similar to a lot of people say this about just doing the next thing, because courage doesn't have to necessarily be these huge acts of, magnitude.
Yeah.
Sometimes it is just carrying on.
Yeah, absolutely. I don't think we sort of sit and think at the end of it, I want to have become a poster girl for this or have done this, and for everybody to, look at me and there to be platitudes and anything like that. It genuinely is just putting one foot in front of the other.
And getting up.
Yeah. Yeah.
When actually it'd be quite nice sometimes just to not, just lay in bed and not get up.
Absolutely.
Yeah.
And probably then actually going on from that is probably realizing when you get up, you help other people get up.
Yeah.
Because it's contagious, right? So if you don't get up, others who are unable to communicate what they are feeling and experiencing feel more alone. And I think it's that thing of how you do when you're raising your children, modeling a certain thing. And I think a lot of it with me with treatment was modeling a certain behavior, so my children would feel a certain way and wouldn't be so scared.
It is. I think that's a really great example of courage, actually, and why, especially for parents. I think just because you are modelling the way that we live, right?
Yeah.
And you're teaching how to be courageous, and you're teaching resilience, and you're teaching all of that stuff just by showing up.
Yeah.
And so, thank you. So, Tashmia, you were diagnosed in 2019.
Yes.
Are you happy to give us a bit of an overview about, point of diagnosis, what treatment, surgical choices, a bit of an overview for us?
Sure.
Thank
you. I received my diagnosis in January 2019 and began chemotherapy in February of that year. And I had chemotherapy and immunotherapy for 18 months.
Tell us the difference for those listening who aren't familiar with those terms, or I think most people are going to be familiar with the term chemotherapy.
Yeah.
Can you give us a little bit of an overview about what the difference is with immunotherapy?
Sure. So chemotherapy is meant to be curative, and immunotherapy was developed to be preventative. So it's administered in a different way, an injection, my one was, and it's meant to help the cells bind or unbind in particular ways dependent on what cancer you've been diagnosed with, to try and prevent that your cells replicating that behavior and tumours to form again.
Yeah. Great. So you were diagnosed at the beginning of 2019. You started chemotherapy and immunotherapy from February.
Yes.
Okay.
Yes. And then I also had 10 rounds of radiotherapy. Actually, I can't remember if it was 10 rounds or 15. It might have been 15.
So long ago.
I'm thinking about
like
the amount of days I had to go to, because it was all one after the other, going into hospital every single day.
So it was around the same time as mine, I remember, because
Yes.
when we first met. So I remember mine being every day for 3 weeks, 5, so it was 15.
So, yes.
So it may have been
that. Yes.
But I think some people get less than that.
Yeah,
some people,
it was 15.
Yeah. Don't downplay it.
I think
Go shorten it down to 10. Okay.
Yes. And I had surgery. I had a mastectomy.
Yeah.
And DIEP, which is where they take the fat from your stomach. Mine was a lateral DIEP, where they take it from the stomach and do the reconstruction of your breast with that tissue.
Okay. There's a single side.
Yes.
Okay.
Yeah.
And then anything else after that? So you're at a point where you've had diagnosis, you've had your chemotherapy, you've had immunotherapy, you've had radiation, then you've had your single mastectomy with immediate DIEP reconstruction.
Yes.
Right.
Yes. Yeah. It was a 15-hour surgery.
Wow.
And then immunotherapy carried on.
Yeah.
And I had symmetry surgery on the next side. There was a delay, though, because of COVID. So I had to wait a while for that before they thought it was safe enough.
I see. Okay. And the symmetry surgery was to align with the reconstructed side.
Yeah.
Right. Okay. And that was through COVID.
Yes, COVID happened, in the second half of my treatment.
Okay.
So I had to critically shield for the 6 months. Yeah, which meant my children weren't allowed to leave the house either.
Goodness.
Yeah.
Okay. So I'm really interested then around your healthcare.
Mm-hmm.
I'm interested to hear a little bit about your experiences through that, because, I know that's almost a step-by-step milestone piece.
Yeah.
But the intricacies in the care that was woven in that, and how much you were in the driving seat versus back seat, and the rest of it. Tell me a little bit about that.
I had a really mixed experience. I didn't feel like I was in the driving seat for a large amount of it. It actually took 3 years for me to be diagnosed. My first mammogram was in 2016, where I had repeatedly gone to the doctor and said that something didn't feel right. And I kept on getting the milk letdown reflex, but I wasn't breastfeeding. And I kept on saying to them, this is really strange. I just keep on feeling like I need to breastfeed.
Yeah.
And the doctors just kept on treating me like I was, I don't know, imagining it, making it up. Because I'm a lone parent, I got put on antidepressants instead. And then they asked if I needed counselling and if I was exhausted or overwhelmed. And it took 3 years of me constantly going in and having blood tests and them telling me to stop taking supplements, despite the fact that I wasn't taking supplements because certain things were completely where they shouldn't have been. I've just knocked the mic. Sorry.
It's okay.
And constantly sore throats. I constantly felt like I had the flu. My body hurt, sore throats. So yeah. 3 years.
So and the investigative, I suppose, side of this, they were just doing blood tests to rule things out.
Blood tests. They sent me to gastroenterologist, because then they were saying maybe it's like bile juice or acid coming up from your stomach and irritating your glands. Then they, had investigative things in my throat and. Oh, there were so many things, and they were trying to say that something had happened in my nose that might be making me feel so unwell.
But what about this letdown? Like the breast, the localization of the kind of nipple breast?
Yes, and yes.
Were they talking about that at all? Did they do anything around that? Or
no, there was just the mammogram I had in July of 2016, and after the mammogram, they didn't do an ultrasound, they didn't do a biopsy. The consultant said to me that because I was under the age of 40, there was no way that I had breast cancer, and he didn't see that there was any point to do any other investigation. So yeah, that led to the 3 years of me being investigated for everything else, until my nipple visibly changed. And then I still had to go to the GP several times and them give me creams for fungal treatments and things like that. And still, when they sent me to the breast clinic, I was told that I was too young and it was very rare, and they didn't see many British South Asian women come in who had breast cancer. And it was only because one doctor read through my files and he said that he was really taken by the way I had described my symptoms and this feeling like I had this letdown reflex. And by this time I also felt, there were no lumps I could feel, but I felt almost how you would feel if you had a crisp packet underneath your skin. Like there was this crinkly sensation I kept on getting. And he did a biopsy guided by me because he couldn't see anything on the ultrasound. And 2 days later they called me and said I had to go in straight away.
So now you've gone in 2 days later. What's that conversation?
It was a very interesting conversation because obviously at that stage I haven't had my staging scans.
Right.
So they do not know what we're dealing with.
Yeah.
They just know that it's cancer.
Yeah.
And I think they just clipped the side of it. And they had taken scrapings from the top of my nipple as well. So they realized there was something there also. But then, yes, from then till when chemo started, a month and a half later, it was really confusing because you're waiting to find out what it is that you're dealing with. And I did have the experience of when I came in to be given the news, a huge amount of the doctors couldn't look at me because they had seen me before and they had all said...
Pushed you off, like,
yeah.
so, you know, wow.
Yeah. And then when because I always carry a notebook, and I had taken note, and I asked, I think they were waiting for me to sort of break down and things, but I go into sort of productive mode. I was notepad, okay, tell me, I might forget this because of all the emotion. Can you tell me what it is? I'll write it down. And I'll never forget, my consultant said to me, not today. When you come in next time, bring your husband and then we'll explain it to you. Yeah.
I'm actually speechless.
Yeah.
That's what they said that to you.
Yep.
Not this time. Bring your husband in next time, and
we'll just
wow.
explain it to you. Yeah.
What? What did you say?
At that point, I think I laughed.
Yeah.
And I said, well, what husband? I said, I don't think I could get married in time for the next time. So will you just tell me? Which was, I think then they got a glimpse of what they were going to get from me for the next 2 years.
Yeah. Strap in. We're going. You started this.
Yeah.
Okay.
Yeah.
Honestly, that's floored me a little bit.
Yeah.
Firstly, the assumption. But secondly, the fact that you can't possibly be of sound mind
yes.
without a counterpart to come in. Maybe, okay, so sitting on the fence, maybe the intention was, doesn't matter if it's husband or somebody else, bring somebody, because then that we can give you all of that. And, you know, I'm sure that's the intention. That was the intention.
You're being very generous.
I'm trying to be, because
the same
I'm
consultant
astounded.
when it came to my mastectomy and reconstruction, I didn't want reconstruction. I had asked for a double mastectomy, and because I was so terrified, I was like, if it comes back on the other side, just take them both. I don't care. I was like, I can finally wear backless dresses without ever worrying about a bra. I was like, it's fine. You know, I've had 3 children. I'm fine. And he actually said to me, no, you're really young and you may meet somebody and then you will regret it.
Oh, Tashmia, this is giving me like... I've had similar. I had similar conversations with my
I
consultant,
remember.
right? We spoke about
I remember.
this, and my head can't compute it that those things, even if they are thoughts, you know, for them to come out of their mouth, that's a real belief, you know, in what they're saying.
Yeah.
Okay, so you've said, I don't want the cancer in my body. Take it, and can you take the other one while you're at it, because I would like to reduce risk of recurrence. Right? They've said no. You're too young. You might meet someone who might want you to have breasts.
Yes.
Okay. So, and so, but you then reconstructed.
Yes.
So you said, okay.
Yeah. In the end, I had to see, they appointed me a psychologist. I had to have loads of sessions, spoke to surgeons, and in the end, I agreed.
Yeah.
Because they did say they wouldn't, no matter what, it wouldn't be a double. So then in the end, I agreed, because I was like, well, I don't want to be... not symmetrical. So then...
Goodness me.
Yeah.
Okay, so let's talk about then today as someone with two breasts, you know, and they are symmetrical.
Yeah.
How do you feel?
They're symmetrical. I don't have a nipple on one side,
right,
because from the shavings, they found out that I had something called Paget's disease as well, which can come hand in hand with breast cancer. So I had the milk letdown reflex I was feeling. I had cancer in all my ducts, and it had gone from my ducts into my nipple on the inside, so they had to remove all of that. Okay. So in that way, it's not symmetrical. It's strange. I thought it would be something that later on will hit me and would impact me. I couldn't judge how it would impact me, but I've been expecting it. Obviously, I don't know if later on in life it will impact me, but it hasn't yet.
Yeah.
It really doesn't. They gave me a nipple that I could wear if I wanted, to stick on underneath outfits and things, which in itself was a really strange... I don't know if you ever went to the prosthetics departments and things. I actually found that one of the most upsetting parts of my treatment, because I didn't understand how it was meant to work. And the member of staff who was there, I'm not sure what title they have or any, you know, what qualifications they have, what role they have in the hospital and in medical care. But she had said to me, which one do you want? And it was like, these aren't shoes. And also, how do I know? Like, you tell me, what am I supposed to go for? And also, they were all pink. And it was... why would I get rid of something that was brown and then replace it with something that is... It just couldn't... I couldn't understand it. I couldn't... And so also with the silicone nipple they gave me, it was pink. And it didn't feel like it was something that was there, that was provided for me or people like me.
So, because if prosthesis are supposed to almost replicate something that is, you know, no longer there, you would think that there would be more provisions to make sure that that was an inclusive... as a white person, I had not even considered that. I've not even considered that.
And I didn't realise how upsetting I would find that. And when I went home, they're still in their boxes and never took them out.
Right.
Yeah. It had a profound impact of me realising actually you don't see me and you can't provide a service and care. And
was that spoken about at all in that space? Did the care professionals say, I'm aware that there are pink prosthesis and actually you are a lady of colour? You know,
nothing. It was something I pointed out towards the end when after they had chosen the breast that I could wear if I wanted to. When they brought out the case and opened it with all the nipples in it. which is just like, yeah, like you're choosing a ring, you know. And it was just
surreal.
It was at that point I said, you're going to have to help me. I was like, because I'm floored by the fact that they're all pink.
And what was the response? How did they respond to that?
She just seemed really annoyed by me, like I was causing a fuss. It was just, I should be grateful.
Oh, I was going to swear. I told her
She was just very, very annoyed with me. So I asked her to choose, and I took what she gave me in the boxes and I left.
I'm so sorry you've had that experience. I'm so sorry you've had that experience.
But so many women are probably having that experience all over.
Yeah. Do we think anything's changed? I know, obviously, if you've not been back to that space, and we're talking kind of, what were we now? 6 years ago, 5, 6 years ago.
Yeah.
Are we hopeful that anything has changed in that space to make more of an inclusive provision to support the people and the women who need that service?
To be frank, obviously I'm hopeful of that.
Yeah.
But there is no way it has happened. If we, these things are systemic. It's not, we've spoken about this before. It's not just the NHS. Yeah. The NHS is a body who we have in this country all over the world. This is systemic. It happens to women everywhere. Black and brown women experience this in countries all over the world. I can't see how it could have changed. But financially, in this country, where everything, services are being shut down, I can't see how anybody could have put something in place where people have been trained, where new prosthetics have been created, have been bought. Any of those things have been put in place.
Yeah, I would just
that practical issue.
Yeah, I definitely think there is a practical, as you say, there's a financial implication. There's lots of reasons why that potentially commercially it's not viable, whatever that is. It doesn't stop humans being better.
No.
And humans going, are you okay?
Yes.
Yeah. I'm aware what you see here.
Yeah.
It isn't your skin colour. Yeah. I'm sorry for that.
Yeah.
Is there what can I do to help make this an easier experience?
Yeah.
Because then you're left to having to advocate for yourself again.
Yes. Yes.
And
it feels like a repeated thing. The advocacy, self-advocacy seems to be just something that happens again and again and again. Yeah. Beginning of this year, I accidentally overheard doctors speaking and saying that I was a BRCA2 patient. I've never been told this before. I overheard them speaking in the staff room.
And so you have the BRCA gene mutation, and that's how you found out. Right.
I still don't know. I'm still pushing to find out. That was in January this year, I overheard. And then I asked for clarification. This was in a specialist clinic. And then I spoke to my main consultant. It took me a couple of months to be able to see him, and he denied it. And they have been batting it back and forth, but nobody has shown me any paperwork or has answered me as to whether I really do have it or I don't have it.
Wait, they talk about cancer being a battle, right? So you see, fighting cancer and stuff. And for me, the more I hear from people, it's not around fighting. It was never about fighting cancer. You can't win. That's not something. No. It's not a fight, right? But the fight is for yourself.
Yes.
Right, to advocate for yourself and to get clarity and the things that you need.
Yes,
and that's where the almost the fighting and the battle terminology, because it sounds like it's been a battle, and it sounds like it's still a battle.
Yes, and it's hard for everybody, right? When you're having this treatment physically, you're flawed, emotionally, mentally, in every way, you are flawed. Yet you still have to find the strength to be able to have these discussions with people, healthcare providers, where you are questioning them, despite the fact that they are the professionals, they are qualified. I have no idea, but I'm sitting there up at night reading away and trying to find out and trying to find other people's stories and what other women have experienced and how they got through it in order to be able to get the care that I require.
Yeah.
To be alive.
I'm sorry you've had to go through all of this, you know, and I say also alone, you know, without that construct. But let's talk about family, you know. So I know you've got 3 amazing kids,
Yeah.
right? One of them who was obviously quite young at this time.
Yeah.
What was your support network? What did that look like? What was your support function?
Friends. I had some very good friends
Okay.
who were around, who helped in those first 3 to 4 days after each chemo dose, where I really don't remember what happened. I was just in and out of consciousness and pain and everything else. Who would all rally around and bring meals and distract my youngest and take her away for sleepovers and things. Thankfully, my older 2, of course, it impacted them, but they were also at that stage in life, adolescence, where they kind of, the friends matter a lot, and them just being able to socialize and you're not getting in the way of that is actually
maintain a sense of normalcy for them, right?
Absolutely.
So I get that.
Absolutely, yeah. But yeah, it was definitely friends. I very early on with the discussions I had with my healthcare team, I actually told a consultant that I felt like I was being gaslit, and I began taking a friend with me to every single appointment I had with consultants, as well as writing everything down. And with friends, we discussed this. We made a choice that each friend who went with me to those appointments was always going to be a white woman.
Right.
And I really feel that made a difference to...
Let's talk about this.
Being heard and listened to.
I think this is... let's talk about this. Because, as you said, as a South Asian British woman, if they said, you know, we don't see people, you know, of your heritage in here, so it can't possibly be that. But the minute that you bring a white person in with you in that space, there is... Are they listening? Are they speaking differently? Tell me what's happening.
Quite a few times I found some of the consultants would actually address my friends instead of me. So I would ask a question and they would turn around and they'd look at them, and I'd be there just thinking, well, I'm the one. Then I felt infantilized. I felt like they were my parent and I was the child, and that's how it was being responded to. But I definitely was not dismissed the way I was in appointments where I went on my own.
Okay. And it's the same team of people that you had from those early days, and those ones that wouldn't really look you in the eye because I'm going to call it shame, total shame that they dismissed, ignored your clear understanding and concerns from years ago, actually.
Yeah.
And then did anyone actually ever say, look, we got this wrong, we're sorry, we should have picked this up?
Through all of that, no. Only recently, my main consultant during this whole BRCA gene debacle sat me down and said, look, I'm absolutely certain you don't have it. There's no way. He goes, if I've made that mistake, I will leave the profession, because there's no way I could have made that mistake, because I've treated you through all of this. And I remember how all of this started and how we missed it the first time. That was the one and only time.
Acknowledgement
and he told me
of that.
This year.
And in passing.
Yeah. And only because he was absolutely terrified, because I said, I should have had a double mastectomy. You should have removed my ovaries. If I have the gene, all of those things should have happened.
Yes.
And I didn't make a informed decision then. Everything in my treatment plan was wrong.
Yeah.
If I have it.
Where can you go from here with that kind of anomaly of information? You know, you've got this massive thing that's hanging over you. Do you, don't you? And they're not willing to show you any kind of evidence to give you clarification, apart from a surgeon that you know, with respect, missed something and definitely has been there, so does know the ins and outs, and has kind of given you his word that it's not this. Yeah. It's hard, isn't it? Because when that trust is not there with a medical team for whatever reason, it's very hard to then take someone's word for it, especially when, as you say, you felt gaslit, you've been gaslit.
Yeah. It's definitely hard to trust. And again, it leads you to constantly have to ask questions, which is exhausting. I don't want to have to ask those questions.
Also, then it almost kind of perpetuates this this annoyance that we talk about people having for challenging and asking questions.
Yeah.
And then you're in a cycle that's, that you don't want to be in. You're
No.
just asking for clarity. And actually, why are you
Absolutely.
giving clarity to my white counterpart, but you can't look me in the eyes and give me clarity without asking for me to bring my husband in?
Absolutely.
Who actually, if you were having a different conversation with me, you would have known that I was a lone parent.
Yeah.
Yeah. I am. Yeah, thank you for sharing, because there's a huge amount in there, and I know that, and I say this sometimes, but we could go on holiday for a week, and sip cocktails by the beach, and we still would have stuff to go, mouths aghast.
Yeah, completely.
Can we talk about impact on physical body, your sense of self-esteem briefly? Can we touch on that? Because obviously, initially you've gone, just get it out. I want to be symmetrical, whatever it is. I don't want to not. So, but you've reconstructed, and actually you're feeling good. You're feeling like happy with your body, apart from the fact that you don't have a nipple. Yeah. You have a nipple in a box.
Yeah.
Pink nipple in a box in the cupboard somewhere. Not helpful, but it's there. Okay.
Yeah, I think it has actually. When I said I've not taken it out, I think my youngest, when she was smaller, did used to take it out and play with it and like stick it under her tops. And I think once the breast did come out like a pregnant belly where she was walking around the house. So, but otherwise it hasn't come out.
My daughter did the same. So I've got prosthetic, but again, I've never worn them. But I thought I might want to wear them when I was swimming, right? Yeah. Because sometimes when I swim, as a flat woman, I don't have an issue with it. I don't think anybody else is looking. Yeah. But I remember being in a stage where I thought people would look, and I did want to not be, I didn't want to come across in my head really obvious that I was flat. And so I got aqua boobs.
I've not even heard of those.
Well... They're blue, and apparently they're waterproof, but they're still silicone, but they're aqua boobs. But I remember my youngest came out with both boobs, right? And she'd kind of, I don't even think they're on her chest. I think they're on her shoulders, like 80 shoulder pads. But
love that. Just fine. In case you're from Andor or something.
Exactly.
Blue ones as well.
Blue. You can have a bath with them. So, okay. So, but for kind of overall, you're happy with where you're at in terms of symmetry, apart from obviously not completely symmetrical underneath clothes and the rest of it. How do you feel? How's it impacted body?
It's really interesting, because I'm not sure how you found it, but say the discussions with my consultant about how I might feel later on, and if I meet somebody and how my body might look, and psychologists you need to have the appointments with to make sure you fully understand what the surgery is going to be and what you're going to look for, and also a huge amount of conversations I had at the beginning of my treatment about my hair. It seemed to really bother all the professionals that I was going to lose my hair, and they worked very heavily to try and convince me to have a wig. And I refused, and they just couldn't understand it. And they kept on telling me that I was going to, they were worried that I wouldn't understand the impact it would have on me when I didn't have any hair. None of those things actually in any way made me feel what I anticipated it to make me feel, or how they anticipated me feeling. It's strange. I don't know why, but I just don't. When I look at my scars, I don't really worry about them. It's really strange. I think prior to being diagnosed, prior to having treatment, I probably was more insecure. If I went to a party or a club, I would be more aware of the super svelte person on the dance floor, or someone's hairstyle, or numerous things would have bothered me. Now I don't seem to notice it at all. I wear exactly what I want to wear. I don't, probably in a way that maybe I need to kind of curb that, because maybe there are things I'm wearing that I shouldn't be wearing, but I don't seem to care anymore. If I see something and I like it, I'm like, I'm going to wear it. Does it fit me? Who knows? But I'm going to wear it.
Do you think that's because of the journey you've been on? Do you think that as a result of cancer and being at the the tip of kind of life and having to go through everything that you've been through, when you come out the other side, and it looks totally different to this, what it was before.
Yeah.
But actually, the perspective changes.
Yeah.
So therefore, I don't know, this sense of empowerment, maybe.
Yeah.
Do you think that's what it is? Or
I
because
think
sometimes
so.
when we speak to people, it can be the opposite, actually. Right, up until that point, I had everything going for me. I had all the things I wanted, and then cancer or whatever this was, and everything the confidence has gone.
Yeah.
Self-identity has shaped and shifted.
Yeah.
And people are struggling.
Yeah.
But it sounds like actually the old you that had these insecurities about other things, that was goodbye with the cancer.
Yeah.
Because actually now,
yeah,
I'll wear what I like. I'll dress how I would like.
Yeah.
I'm quite happy in the skin that I'm in. I'm okay with everything.
Yeah. Yeah.
It's interesting to see which way it goes, because it can go one of two ways, right?
Absolutely. And I don't think there was anything I consciously did or anything super special about me or anything like that. There was just a shift that happened in a way that I was unaware of as it was happening, where just suddenly things that used to matter in that way didn't matter anymore. And I think it's incremental. There are little things that happen. So before I had outfits that I would say for special for events out, or, if I go to a wedding or things, shoes. But to the point that if people gave me gifts like a nice candle or a cream, I'd be like, oh yeah, I'll use it soon. But they'd all just sit there. And
save it for good. Save it for best. Yeah.
And I think it all became part of the same thing, where I was like, well, actually, what am I saving for? What? Like, I might not be here tomorrow. So if I want to go to like a book reading wearing a completely sparkly outfit and heels, I do. I just do, because it's like, well, who else is going to use those if I don't use those? And I think it's just part and parcel of all of that. Just very, very slowly, there was this shift that happened where, certain things that I thought were going to be very important to me were no longer important to me.
So we met when you had short hair. So obviously,
it was very short at that point. Yeah,
and I had just finished chemo, so I didn't have any hair. I think my hair was just starting to grow back. So actually, seeing you today is always, there's been a bit of a time passing.
Yeah,
and you look great then. You look great now. You know.
Thank you. Same to you, though.
Thank you. Cheers. Cheers to that. Okay. I've got one final. So we start and close with a bit of a hard one. It might not be hard. If you had to give a piece of advice to someone who was going through, it's just at the beginning, who was about to go through, what to be the journey, what would that be?
Ask for help. If there's anything you're unsure of, anything you're struggling with, don't try and be courageous. Don't try and put another burden on yourself. Ask for help. Speak to your friends, speak to your family, speak to whoever you can who's able to be there at that point. And don't go through it alone. Yeah.
What would you like to see change for British South Asian women in the cancer space?
I'd like to see us getting to a place where people talk about it more, where it's not a taboo. When people don't speak about it and it becomes a taboo, various different things happen in society. You become ashamed of it when it happens, almost like it's your fault it happened to you. Why didn't it happen to someone else? Also, you don't see all the other people who are going through it, so you believe it's only you, so it's your fault. Whereas if you saw more women it was happening to, if people discussed it more, I think that would make a huge impact to people's process of going through their treatment.
Yeah.
And healing.
Thank you. I've really enjoyed this conversation.
I have too. Thank you for asking me.
No,
to
you're
be
so
here.
welcome. I haven't eaten the biscuit,
I
so
haven't
I think we
either.
should eat the biscuit. But thank you.
Thank you.
It shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.